2018, we received funding from the Australian Government Department of Foreign Affairs and Trade through the Indo-Pacific Centre for Health Security to launch our project called Strong Timor-Leste, which is surveillance, training, research opportunities and national guidelines for communicable disease control in Timor-Leste.
The Strong TL project in Timor-Leste started on the basis of really close relationships between researchers, clinicians, scientists, epidemiologists in Australia and in Timor-Leste who saw an opportunity to work together to bring parts of the health system together to build capacity within the health system for responding to infectious diseases challenges especially. Timor-Leste has so many challenges with infectious diseases and has for a long time. And to respond to infectious diseases, you need to have a strong clinical response, you need to have a strong laboratory system, and you need to have a strong public health system that does surveillance in Timor-Leste called Vigilancia. And so we wanted to work with the Ministry of Health in those areas of the health system to build capacity in a way that would see those parts of the health system working closer together. And through all of that, to use operational research, health systems research to understand some of the challenges with infectious diseases in Timor-Leste, but also to look at ways that the health system could respond in a stronger way to them.
My role is the epidemiology or surveillance mentor at Strong Timor-Leste. So I'm an epidemiologist in Australia, and before my career as an epidemiologist, I was a medical scientist. We had a focus on mentoring, so working side by side with Timorese colleagues to help them with the work that they need to do day to day to control communicable disease. So responding to notifications of disease, investigating outbreaks, and increasing capacity in both the laboratory, clinical, and surveillance areas.
My role in Strong TL project in Timor-Leste mainly is coordinating the activities of the funded project in Timor-Leste and liaising with the Ministry of Health for all the Strong TL activities. I coordinating all the research activities that Menzies is doing here in Timor-Leste. I'm really grateful that I can join this important project to help Timorese junior researcher and taking part in health sector research in Timor-Leste.
Strong TL project is the first project, big project by Menzies School of Health Research in Timor-Leste. I'm very proud to be part of the team, leading as in work side by side with my colleagues from Australia, as well as most importantly my colleagues from Timor. The proudest thing about Strong TL is that the implementation itself is leading by the Timorese, and what support that we're able to provide also contextualized into the Timor setting. I'm very proud to see how the team has grown over the past 5 years, how we have come into work with our counterparts, both with the Ministry of Health, and then for the people in the Ministry of Health to really welcome us and work together to successfully implement the project.
An important part of our project was the SORTIT project, which was structured operational training in Timor-Leste. This provides people with an introduction to operational research using data that they collect on a day-to-day basis in order for them to analyse the data and make decisions in their workplace to improve the way they do things based on data they collect.
A short IT training to put myself as one of the participants. I'm very happy to take part on the short IT training because we learn about a lot of things, a lot of methods that we can use for research in Timor-Leste. Menzies support, I have published my research internationally.
In the area of research, it was a big privilege for me to be involved in a few of research done here with the support of Menzies School of Research. So I was involved in seroprevalence of hepatitis B and other vaccine preventable disease here in Timor-Leste. So I think this is very important because we have results that we can use it as an advocacy to have more policies to improve our health in Timor-Leste. And also I can see that the trainings that is done for the junior doctors in the area of research, and I can see the enthusiasm there and the junior doctors to continue or proceed with the research. I think this is really good because we haven't been nothing was done in research in the clinical area before, but we can do we started to do when we had a Menzies team here or Strong TL project. So I hope that with the next collaboration we can continue to do research in the clinical area so we can have more ideas how to improve our clinical management here in Timor-Leste.
Often it's the very first step in somebody's career into research, and when people start, they think things are very complicated and research is very difficult, but over the course of the sorted program, over 3 modules, people realise that you can do research, and if you follow steps, it's actually very easy. And I've seen it myself. People have published many papers already based on their research, and from people who were trembling at the start, they're now very confident, or toman. They feel very comfortable doing research, and they're now mentoring other people.
It was really lovely for us to be able to reflect on the Strong TL project and the 5 years that have been. Particularly over the difficult COVID years, we were really proud to be able to be here working alongside and supporting the Ministry of Health through that really difficult time, and proud of all of the progress that happened and the Ministry of Health's response in the clinical, surveillance and laboratory areas, such that Timor-Leste was able to meet and look after the population here with actually really good outcomes overall.
I came here in May 2020, just before we had our first cases. And our job was to help prepare the facilities and the staff, the nurses and doctors. So we all trained together in teams. We trained in how to use oxygen systems like ventilators, how to keep ourselves safe using PPE, how to prepare the facility and the environment, and also to know more and be confident to treat patients with COVID. It actually took many months for COVID to start spreading in the community in Timor because we had very effective border controls. But when it came, it spread quite quickly, and we received a lot of patients in an alpha and then a delta wave of COVID. And our treatment facilities in Veracruz and Lahane were very busy, but we all worked together as a team to treat patients. I also worked clinically with the Timorese doctors and nurses, and we lived and worked together in the treatment centres for many weeks when there were a lot of patients. Well, I know many people in Timor and all around the world were very scared of COVID. We were scared to get sick. We were scared for our families and our relatives. I also felt scared. I didn't want to catch COVID, but my job, both in Australia and then in Timor, is to work as an ICU nurse. And I'd worked previously here in Timor, so I was in a very good position to help. And that was my job, and many Timorese that I work with, and also some expats, some Malay on the Menzies program came to Timor to help. So I think we all felt a little bit nervous, but we were very, very happy to work together with our colleagues here who we've known for a long time. And so that helped me to get over my fear. And once we got busy and once we started working hard, there was no problem. We focused on what we could do to help, not on being scared.
In the COVID time, it was really good to have Ben as an intensive care nurse together with us in Veracruz and Lahane isolation, especially when we had that Delta outbreak, when we had a lot of patients with respiratory failure. Ben was really helpful, so we managed to have a proper ICU in Lahane with the help of a strong TL team. And still until today, not only for COVID, until today I still can feel that we still have those very big benefits from all these discussions with the infectious disease doctors from Australia.
The National Health Laboratory has been equipped and now has been expanded more than what we had before. Initially, we did not have the advanced capacity to do large number of PCR testing. We initially only do about 20 to 40 tests per week, but then with the recent expansion and also with the COVID-19 response, I think the capacity of the National Lab can do up to 2,000 tests per day. I think that's a massive jump from the initial capacity, and this is all due to the ongoing collaboration between Ministry of Health, the Australian government DFAT, and also Menzies School of Health Research as the implementing partner. I think to move forward, the National Health Laboratory can do a lot of molecular testing. We have the capacity established on the ground. During the COVID-19 response, initially we had about 5 scientists and technicians working inside the molecular laboratory, but now we have more than 28 scientists and technicians working across the departments, which can be readily called upon to do any PCR testing, not just COVID-19, but any other tests that require molecular detection.
I'm proud that we've been able to support our Timorese colleagues to develop evidence-based guidelines to control communicable diseases in Timor-Leste, such as the Integrated Disease Surveillance and Response Guideline, outbreak guidelines, and also supported them during the COVID pandemic to develop guidelines to detect, isolate and quarantine cases. Secondly, I've been extremely happy that the people that I've worked alongside in the Ministry of Health that I've mentored, hopefully I've instilled in them a sense of confidence that Timorese are smart, Timorese can do things, and that we support them when they make decisions based on evidence.
The pandemic was a perfect example of the kind of infectious disease that requires a response from the health system that isn't just one area doing its bit, it's the whole health system working together. And it was amazing to see the way the health system came together in response to the COVID-19 pandemic here in Timor-Leste. Those areas of clinical responding to what were some incredibly challenging times, particularly through the wave of the Delta variant that came through Timor-Leste, but also the strong systems that were established for public health surveillance that was based largely on a very effective laboratory system that grew in strength through the period of COVID-19 in a way that was quite amazing. We had the opportunity, because of this funding from the Australian government, to provide scholarships for 2 Timorese, and one of them was Nevio Cemento, a colleague, part of the Menzies team, who's working on a PhD that is focused on pneumonia in children and malnutrition in children. But through his research and his work, he has also really paved the way for introduction of pneumococcal vaccines in the country, and the pneumococcal vaccination campaign started this year, and he has been a significant leader in that work that is really setting the path for other countries around the world as well in terms of introducing pneumococcal vaccines. And through the course of Strong TL, and while doing his PhD, took on very important leadership roles within the country's response to COVID-19.
as a Timorese researcher and also a PhD candidate supported by Strong Timor-Leste project, I think the Strong Timor-Leste has supported me in every aspect of my PhD career and my studies in Charles Darwin University and Menzies School of Health Research in Darwin. I have been fortunate to be taking part in this project and to be part of this project. It had showed me a lot of ways to study and a lot of ways to understanding the mechanisms, understanding the disease burden, and also the research priorities in Timor-Leste. I've been fortunate enough also because these projects allowed me to collaborate with all the leading researchers. As a microbiologist, I work with a lot of microbiologists and also the professors of infectious diseases in this field. So we mainly focus on the respiratory infections. That's where my research is based, and that's why I have been exposed to high-level research, and this is helpful to build up my career, to build up, to give a strong foundation for me for the future health research development in Timor-Leste. Since the beginning, I have also been exposed to several aspects of research writings and also the grants proposal applications, and all this putting together has put me in a place where I am right now. I am also being fortunate enough with this work that I'm doing with the Strong Timor-Leste, where I was doing pneumococcal research at the hospital, where I collaborated with a lot of pediatricians, and with this research also, it has been helpful for us and also to collaborate with Ministry of Health and National Immunization Technical Advisory Group to assist in introducing the pneumococcal vaccine in the country. So overall, Strong Timor-Leste project has been really affecting me on my personal level, but also in my career as a researcher.
Montero received a scholarship to study with a Master of Public Health at Menzies, Charles Darwin University, and after completing her Master of Public Health returned here to Timor-Leste to work within the Ministry of Health and is now the President of the National Institute of Public Health of Timor-Leste, INSPTL, and it's a real pleasure to be able to continue to collaborate with her and with the INSPTL as we look to work together towards these common shared vision and goals.
The achievement is quite remarkable, I can say, not from the perspective as a leading from a Menzies point of view, but from what we see and what we hear from the Ministry of Health and the support that we've got from DFAT as well as the funder for this project. The method that we use as in Accompagna, work side by side the Timorese in the capacity building between the surveillance, clinical and lab. This has shown a very significant improvement in the collaboration between this to respond to the public health. I guess the measure of this achievement, can be seen through Timor-Leste's response to COVID-19 pandemic, where everybody's come together, worked together to prevent the severe pandemic occurring in Timor-Leste. The achievement, it's not only for the Timorese, but the achievement, I can see that it's measured to ourselves as well as individuals who are working in the project. We have grown, we have developed a lot of knowledge, a lot of collaborations, knowledge in terms of how do we actually interact with the people in the Ministry of Health, and knowledge in terms of how can we improve and contribute to the society through the expertise that we've got. And also knowledge in terms of the fact that Timorese can lead, Timorese can work with the supervision of our expert. The actual work, the actual contribution, the actual achievement itself come within the Timorese.
I hope that these generation of smart Timorese health leaders will also mentor the younger generation who are coming through, and that the younger generation appreciates that there are some very smart and capable Timorese health professionals in this country. My hope for the future is that what we've seen during Strong Timor-Leste continues. So Timorese leading health initiatives with Malai supporting.
Strong collaboration between Ministry of Health, Timor-Leste and Menzies School of Health Research is very strong. This collaboration hopefully can be continued, and so that can build the capacity of Timorese, promoting Timorese not just as the local partner, but can also lead some of the studies, can take up more responsibilities in providing direct contribution to changing in policy, advising directly the policy makers at the ministerial level, at the Ministry of Health especially, also in Ministry of Agriculture and Fisheries, where Menzies is currently collaborating. I think this is the way to do, and with this working model, promoting Timorese, working side by side Timorese, I think this could be a good incubator for young, upcoming, and also the future health leaders to learn inside Menzies or within Ministry of Health, and also in collaborating with Menzies, and then to affect changes in the future.
And so the Strong TL project has come to an end now after 5 years, but there's been a lot of progress that's happened over this time, and for Menzies I think it's also established for us the way that we want to work while we're here in Timor-Leste. We have a number of other projects that Menzies is undertaking here in partnership with the Ministry of Health and Ministry of Agriculture and Fisheries, and we want to continue to support the government with the national priorities that there are here. In the way that we work, we want to be able to respond to specific diseases or issues as they come up and have projects targeted at those things, but also to be able to continue to work flexibly in the way that we have when other things arise, and to continue to focus on the individuals that we're working with to build their capacity such that our local Timorese colleagues are leading these things themselves. The project has finished now, but for us it is not the end. Menzies is staying here in Timor-Leste, working alongside the government of Timor-Leste here, Ministry of Health and Ministry of Agriculture and Fisheries. And for us it is the end of the beginning of our ongoing collaboration and partnership. And we want to see the health system here in Timor-Leste continue to strengthen and continue progress in all of these areas that we have a shared vision.
Strong TL.
Strong TL.
Strong TL.
Strong TL.
For better health in Timor-Leste.
Stronger Timor-Leste.
Stronger Timor-Leste.
So I've been very proud to be part of this project called Strong TL, and I hope that has led to a stronger Timor-Leste.